What if the memory slips that have been keeping you up at night, the way you sometimes lose your train of thought mid-sentence, or that unsettling feeling that your once sharp mind is slowly slipping away? What if those changes weren't the first cruel signs of an incurable disease, but a reversible reaction to something as ordinary as the pills sitting in your medicine cabinet right now? My friends, I am Dr. John Lee. At 65 years old, I have spent more than 4 decades caring for patients, teaching medical students at major universities across this country, and yes, learning a thing or two from my own Chinese-American family about what it truly means to honor our elders. My parents came to America with almost nothing but an unshakable belief that good health and a clear mind were the greatest gifts we could give the next generation. That belief still drives me every single day. I see it all the time in my office. Bright, capable men and women in their 60s, 70s, and 80s walk in worried they are developing dementia. They tell me they're forgetting names, repeating stories, struggling to follow their favorite television shows, or feeling like they're just not themselves anymore. And every week, I get to do something that still brings me tremendous satisfaction after all these years. I get to play detective. I sit with them, I listen carefully to their stories, and I go through every single medication they are taking, both prescription and over-the-counter. More often than you would believe, we discover that the real culprit is not some inevitable brain disease, but the chemical burden their brains have been carrying, sometimes for years. We have been told for far too long that losing our mental edge is just part of growing older, that it is normal, that there is nothing we can do except watch it happen. But I am here to tell you with every ounce of my experience that this is not always true. A very significant number of what looks like dementia is actually medication-induced, or at the very least, medication-accelerated. The good news, my friends, is that many of these changes can be slowed, stopped, or even reversed once we identify the problem and take smart, careful action. Today, we are going to walk through 9 categories of medications that are most likely to affect your memory, focus, and clarity. Some are prescriptions you may have been taking for years. Others are innocent-looking bottles you reach for when you cannot sleep or when allergies flare up. I am going to speak to you the same way I speak to my own patients and my own medical students, with honesty, with compassion, and with the practical wisdom that comes from treating thousands of older adults just like you. This is not about scaring you. I have seen too much fear in the eyes of my patients already. This is about empowerment. It is about giving you the knowledge and the confidence to have better conversations with your doctors. It is about protecting the precious gifts of memory and independence that allow you to enjoy your grandchildren, travel with your spouse, keep up with your hobbies, and remain the vibrant person your family has always relied upon. Before we begin our countdown, I want to ask you something from the heart. Have you or someone you love noticed that your memory or mental sharpness seemed to change after starting or increasing a medication? Please tell me in the comments below. What are you taking? What have you noticed? I read every single comment. Your stories teach me, they teach this whole community, and they remind all of us that we are not alone in this journey. We are going to count down from number 9 to number 1. We will move from medications that are commonly overlooked to the ones that cause the heaviest burden. And I promise you, when we reach number 1, it will probably feel very familiar, because almost every senior I treat has experienced some version of it. Let us begin with number 9. The over-the-counter sleep aids and allergy medications, particularly anything containing diphenhydramine. You know these medicines well: Benadryl, the PM versions of Tylenol, Advil, and many others. You see the word PM on the box, and you think it is perfectly safe because it is sold right next to the toothpaste. But let me explain what is really happening inside your brain. Diphenhydramine is a powerful anticholinergic medication. It crosses the blood-brain barrier and blocks a crucial chemical messenger called acetylcholine. Think of acetylcholine as the brain's librarian. It helps you shelve new memories, retrieve old ones, and stay focused when your daughter is telling you about her day. When you block that librarian for hours at a time, especially night after night, your brain starts to struggle. In older adults whose natural acetylcholine levels are already declining, this can create confusion, memory gaps, and in some cases, full-blown delirium that looks exactly like the early stages of dementia. I cannot tell you how many times I have seen a patient's adult children bring their mother or father in, terrified that Alzheimer's has arrived, only to discover that the nightly PM pill was the main contributor. The research on this is consistent. Long-term use of strong anticholinergic medications is associated with measurable cognitive decline. The beautiful part is how often the fog lifts when we find safer alternatives. If allergies are bothering you, we now have excellent non-anticholinergic options. If sleep is the issue, let us talk about sleep hygiene. Perhaps melatonin used carefully, or other medications that do not carry this burden. The key is this: do not accept that foggy feeling as normal simply because the medication came from a store shelf instead of a prescription pad. Now let us talk about number 8. The gut acid medications known as proton pump inhibitors, or PPIs. Drugs like omeprazole, lansoprazole, and esomeprazole. These medications have changed lives for people suffering from severe heartburn and ulcers. I respect their power, but after years of use, they can create a different kind of problem. Long-term suppression of stomach acid can reduce your body's ability to absorb important nutrients, particularly vitamin B12 and magnesium. When B12 levels drop significantly, the symptoms can be dramatic: confusion, memory loss, fatigue, even nerve damage. I have had patients whose cognitive symptoms improved dramatically once we corrected a B12 deficiency that had been hiding behind years of PPI use. The science here is still evolving. Some studies show a clear association with cognitive decline, others are less definitive. But in my practice, the lesson is clear. If you have been taking these medications for years simply because that is what the doctor started me on, it is time to ask some important questions. Do I still need this level of acid suppression? Could we try stepping down to an H2 blocker or using lifestyle approaches for part of the week? Are my nutrient levels being monitored regularly? Your doctor should be your partner in this. When we address the root causes, instead of just continuing old prescriptions, many patients tell me they feel clearer and more energetic than they have in years. Number 7 brings us to the overactive bladder medications, drugs like oxybutynin, tolterodine, and several others. These medications are very effective at reducing that urgent, frequent need to rush to the bathroom, but they come with a significant cost for many older brains. Like the diphenhydramine we discussed earlier. These drugs are strongly anticholinergic. They block the same acetylcholine pathways that your memory and attention systems depend upon. I remember one patient, a retired engineer named Robert, 71 years old. He had always been the one who could fix anything, remember every detail of his grandchildren's sports schedules, and beat his friends at chess. 3 months after starting oxybutynin, he was struggling to finish sentences and became withdrawn. His family was heartbroken. When we switched him to mirabegron, which works through an entirely different mechanism that does not affect the brain's acetylcholine system, the change was remarkable. Within 6 weeks, his family told me, "We got Grandpa back." That is not a miracle, that is good medicine. If you are dealing with bladder issues and also noticing mental cloudiness, please bring this up with your doctor. You should not have to choose between controlling your bladder and keeping your mind sharp. Modern options exist, and you deserve to know about them. Let us move to number 6, the statins. This one always creates lively discussion, and rightly so. Statins have saved countless lives by protecting us from heart attacks and strokes. I prescribe them when they are truly needed. But we must also be honest about the fact that our brains are made largely of cholesterol. It is not the enemy we once thought. Certain statins, particularly the ones that cross into the brain more easily, have been associated in some studies with memory complaints, slower thinking, and changes in executive function. Not everyone experiences this. Many people tolerate statins beautifully, but I have had patients who noticed a distinct change in their mental clarity after their dose was increased or after switching to a more potent statin. The solution is rarely to stop heart protection entirely. Instead, we look at the specific statin being used. Some are less likely to affect the brain than others. We also look at lifestyle measures, diet, exercise, and other ways to support cardiovascular health so we can potentially use the lowest effective dose. The conversation matters. Your brain health and your heart health are not enemies. They are part of the same team, and we can work to support both. Number 5 is one that requires special care and honesty. The benzodiazepines, Xanax, Ativan, Valium, Klonopin. These medications can be genuinely helpful for short-term anxiety or occasional sleep problems, but in older adults, long-term use is fraught with difficulty. The brain adapts to them quickly. What starts as a small dose often grows over time. The medications themselves are linked to increased risk of cognitive decline, falls, hip fractures, and even higher mortality. I have seen too many patients become trapped in a cycle where the medication that was supposed to help them relax is now contributing to their mental fog and unsteadiness. The most important thing I can tell you is this: never stop these medications suddenly. The withdrawal can be dangerous, causing severe anxiety, insomnia, and even seizures. When a patient and I decide together that it is time to reduce or eliminate benzodiazepines, we create a very slow, individualized tapering plan that may take months. We replace the medication with safer approaches including therapy, mindfulness practices, better sleep routines, and sometimes other medications that are gentler on the aging brain. The patients who successfully taper off these drugs almost always tell me the same thing months later. I didn't realize how much mental clarity I had lost until I got it back. That statement alone keeps me fighting for better solutions. As we reach number 4, we come to the tricyclic antidepressants, medications like amitriptyline, nortriptyline, and imipramine. These were groundbreaking when they were first developed. Today, they are often used for nerve pain, migraine prevention, and sometimes sleep. But they carry one of the heaviest anticholinergic loads of any medication class still in common use. For a senior brain that is already experiencing the natural decline in acetylcholine that comes with age, adding a strong anticholinergic can be the tipping point. I have seen patients who were prescribed low-dose amitriptyline for pain or sleep suddenly begin struggling with word finding, spatial awareness, and short-term memory. The connection was not obvious at first because the medication had been presented as helpful. The good news is that we now have many newer options for pain and sleep that do not carry this same risk. Duloxetine, gabapentin used carefully, or even non-medication approaches like physical therapy, acupuncture, and cognitive behavioral therapy for insomnia can often provide relief without the cognitive cost. If you are taking one of these older medications, it is worth having an honest conversation about whether it is still the best choice for you. Number 3 may surprise some of you. It is a specific antidepressant called paroxetine, often known by the brand name Paxil. While many of the newer antidepressants are relatively brain-friendly, paroxetine stands out because it has significant anticholinergic activity, more than its cousins like sertraline or escitalopram. Many of my patients come to me already on antidepressants for very good reasons. Life brings challenges, grief, anxiety, and sometimes clinical depression that needs treatment. I am not against medication for mood when it is appropriate, but I am against unnecessary cognitive side effects. If you are taking paroxetine and also noticing memory issues, please do not stop on your own, but do ask your doctor whether switching to a different SSRI with a cleaner profile for the aging brain might be worth trying. I have witnessed This switch restores mental clarity for many patients while still effectively treating their depression or anxiety. The brain is remarkably adaptable when we remove unnecessary obstacles. Number 2 on our list involves the antipsychotics. These medications, including quetiapine, risperidone, and others, are sometimes prescribed for behavioral symptoms in older adults, particularly in nursing homes or hospital settings when someone becomes confused, agitated, or has trouble sleeping. This practice troubles me deeply. These drugs carry a black box warning from the FDA because they increase the risk of stroke, sudden cardiac events, and mortality in older adults with dementia. They can also further worsen cognitive function. Too often they are used as a chemical restraint instead of addressing the real causes of distress: untreated pain, urinary tract infections, dehydration, medication side effects, vision or hearing problems, or simply loneliness and lack of meaningful activity. Before we ever reach for an antipsychotic in an older person, we should be asking much more fundamental questions. Is this person in pain? Are they scared? Do they need human connection? Could a change in environment or routine help more than another pill? Non-drug approaches should always come first. When medication is truly necessary, it should be used at the lowest effective dose for the shortest possible time, with constant reevaluation. Our goal must be to preserve dignity and cognitive function, not trade one problem for a worse one. And now we arrive at number 1, the champion, the medication burden that accounts for the majority of reversible cognitive problems I see in my practice. It is not any single drug. It is the combination. It is anticholinergic polypharmacy. You may be taking a bladder medication, an over-the-counter allergy pill, a tricyclic antidepressant for pain, a sleep aid, and perhaps something for vertigo or stomach issues. Each medication by itself might seem reasonable. Each one might be at a low dose, but when you add their effects together, the burden on your brain's acetylcholine system becomes overwhelming. It is like having 5 different people all trying to talk on the same telephone line at once. The message simply cannot get through. Your memory suffers. Your focus fades. You begin to doubt yourself. Your family begins to worry. And everyone assumes this is just old age or the beginning of dementia. I want to tell you about Margaret. She was 68 when she came to see me, a wonderful woman who had spent her career as a school teacher. She was active in her church, played bridge every Wednesday, and adored her 4 grandchildren. Then the bladder urgency started, then spring allergies, then some trouble sleeping after her husband had heart surgery. Her primary doctor added a mild antidepressant to help with sleep and anxiety. Within 4 months, her family was having serious conversations about memory care facilities. Margaret was repeating the same stories, forgetting where she parked at the grocery store, struggling to keep up with conversations, and becoming tearful because she felt like she was losing her mind. When I sat down with her and her daughter and we listed every single medication and supplement, the pattern became clear between the bladder drug, the antihistamine, the antidepressant, and even an over-the-counter motion sickness medication she took for occasional dizziness. Her anticholinergic burden score was through the roof. We did not stop everything at once. That would have been dangerous and irresponsible. Instead, we worked with her doctors to systematically replace the most problematic medications with safer alternatives. We addressed her sleep through non-drug approaches. We corrected a mild B12 deficiency. We made sure she was well hydrated. 6 weeks later, Margaret's daughter called me in tears, but this time they were happy tears. "Mom is back," she said. "She's beating us at bridge again. She remembered all the grandchildren's birthdays without any help. That was not a miracle. That was medicine practiced with attention to detail and respect for the aging brain." My friends, this is why I make these videos, because stories like Margaret's are far more common than most people realize. The fog that terrifies you may not be permanent. The confusion that makes you worry about becoming a burden to your children may be reversible if we simply look carefully at the chemical load your brain is carrying. So here is your action plan. This is the homework that could change the rest of your life. First, gather every single pill, tablet, capsule, and supplement you take. That includes the ones in your bathroom cabinet, the ones by your bedside, the vitamins from the grocery store, the allergy medicine, the sleep aids, everything. Put them all in a bag and bring them to your appointment. Second, schedule a dedicated medication reconciliation visit with your primary care physician, or even better, with a geriatric pharmacist. These professionals are absolute experts at seeing the big picture. Ask them to calculate your total anticholinergic burden. The tools exist. The knowledge is there. Third, be direct and respectful when you speak with your doctors. Say something like this: I am concerned that some of my medications might be affecting my memory and sharpness. Can we review whether any of them could be reduced, replaced, or stopped safely? Bring a notebook, take notes. You are not being difficult. You are being a responsible partner in your own healthcare. Fourth, remember that cognitive changes in older adults are almost always multifactorial. We must also check for vitamin deficiencies, thyroid problems, sleep apnea, depression, hearing and vision loss, dehydration, and even poorly controlled diabetes or high blood pressure. A clear mind requires a comprehensive approach. Fifth, be patient with the process. The brain can take weeks or even months to recover once the burden is lifted. But many of my patients tell me that the improvements they see in energy, word recall, and overall sharpness make the journey worthwhile. If you are watching this video because you are worried about a parent, spouse, or friend, please share it with them. Send it to your children so they can help advocate for you. The conversation about medication safety needs to happen in every family that cares about its elders. And please leave a comment below. Tell me what you discovered when you looked at your own medication list. Tell me about changes you or your loved ones have experienced. Your stories are powerful. They help other seniors feel less alone. They help doctors like me continue to refine our understanding of how these medications affect real human beings living real lives. At the end of the day, I want you to walk away from this video feeling hopeful rather than frightened. Your mind is worth protecting. The years ahead can still be rich with memory, laughter, connection, and purpose. You do not have to accept mental decline as inevitable when so many contributing factors are within our power to change. Thank you for spending this time with me. Thank you for trusting a 65-year-old doctor who still believes that knowledge is one of the greatest medicines we can offer. Keep asking questions. Keep advocating for yourself and for the people you love. And above all, keep cherishing that remarkable mind of yours. It has carried you through a lifetime of experiences, wisdom, and love. It deserves every bit of protection we can give it. I will see you in the next video, my friends. Until then, take good care of yourselves, and remember that it is never too late to fight for the clarity you deserve.